here's my setup. I'm just going to talk a little bit about phlebotomy. This is a straight needle and a hub. You just put it like that. That's the most common type of blood draw we do. It's with the straight needle, and it gets good results. And some of the common blood tests we do are TSH, we'd put that in green. CBC, that would be complete blood draw. It has white cells, red cells, hemoglobin, hematocrit, platelets, all that goes into this lavender top tube. Our blue does our coagulation tests. It checks for clotting and stuff like that. Like you can get a D dimer and PT, PTINR, APTT. All kinds of coagulation tests go in that. And then we've got a red one. This one tests the serum exclusively. Like if we're doing a viral test, we'll use a red top. Also drug tests. We'll use drug tests for that one. And then our gold top, it has ixotropic gel in there. When you spin it down in the centrifuge, it separates the serum from the plasma. And so tests that just need serum, we'll take the serum off the top and run that through. We can use it for just about any chemistry test, such as like phosphorus, magnesium, calcium, all kinds of stuff. Like anything, almost anything you can test for in a green, you can test for in a gold. Exceptions would be like ammonia, which is a blood gas. That has to be a green. And ammonias are special in that they have to be tested within 5 minutes or put on ice. We just stick it in a slurry if an ammonia is required. And then last, always last, is the gray top. That is, it's got sodium fluoride in it, so we don't want to cross-contaminate that sodium fluoride with any of these. It's very important not to get this until it's the last tube that you're going to get. This most commonly is used for lactic acids, and I'm not exactly sure how lactic acid indicates infection, but when a doctor suspects infection, they'll order a lactic acid. So those are our major tubes for regular blood draws. If we have an issue where a patient has like small veins or like sensitive veins that could blow easily, we'll use, and of course if the patient is younger than I'd say 7, we'd go and use a butterfly, and I just love them. They make drawing so easy. Butterflies come with these little strings attached, and the blood goes through the tubing right there. It's a lot smaller. You can't really tell the difference between the gauges. Here's a side by side. Yep. Here's a side by side of the two gauges. This one's a lot smaller, and this one comes with a safety cap. So, but anyways, I love butterflies. They make it so easy to draw. And the two extensions for the butterfly would be a hub for continuous flow. Like once you get in the vein and you pop in the tube, you can just leave it in there and then change out the tubes like so once you establish blood flow. Or you can use a syringe, and I like syringes when the person has kind of fragile veins and you don't want to collapse the vein, which when you're doing a hub like this, the power of the suction in the tube could collapse the vein if it's trying to pull too much blood out too quickly. But a syringe, you can actually control how much blood you're pulling out. And you can keep an eye on the vein itself, and, it's just easy. And then after you're done, you take the needle out, and you're supposed to screw this off and put another transfer needle. We call them transfer needles. But a lot of times what I'll do is I'll just, this sheath wouldn't be up, it'd be back down. I just stick the needle right in the tube, and then be sure to keep this upright so you don't get any air. With these butterfly tubings, you always get air. The air from this tubing right here will always be in the blood. You just have to be careful not to get that in there. That's especially important when you're drawing blue tops, because the if you can see, there's a little amount of let's see, what is it, sodium citrate in here, and it's very important that ratio, the sodium citrate to blood, is kept perfect, because it's sensitive. The blood tests for those coagulation tests, they're very sensitive, so they have to be at the exact right range or it won't read correctly. Okay, and then another type of blood draw we do is blood cultures, and I love blood cultures. This was the first successful blood draw I ever did, was into a blood culture tube or bottle. You can see it's a bottle, and it's got, like, I don't know if it's showing up, but there are little granules in here, and they help develop bacterial growth. They help the bacteria grow up. So if a doctor suspects blood sepsis, if they suspect sepsis, they'll order a set of these. This is what a whole set looks like. You've got the aerobic and the anaerobic. It means it doesn't have any air in it. And then you have peds. And peds, I think, is a mixture of the two, but slightly anaerobized. And so if a doctor suspects sepsis, they'll order a set of these, and we go get them. The thing that's special about these is, because we're looking for bacteria specifically, we don't want to catch any extra bacteria like skin bacteria. So we will go in and do everything as usual, but when we clean the arm before the stick, we'll go through with some ChloraPrep. This is what we're using now. We used to have betadine, but we started using this ChloraPrep stuff. It's pretty good. And another thing about blood cultures is you want to draw from 2 different sites 15 minutes apart. And that's to show that there's, like, if one set of cultures, like this is a single set right here, the aerobic and the anaerobic, that's one set of cultures. And that'll be, like, let's say if I take it from my left AC, right, you're going to wait 15 minutes and then come back in with one of these, preferably on the opposite side of the body. But if one shows up extremely positive and the other one shows up negative, that helps determine where the infection is stemming from. So it just helps locate the infection, doing it that method. Once these are drawn, we put the bottles, we log everything down, like where the site was and what specific time we took it at, how long we waited in between. And then we put it in a machine called a Bactec. And the Bactec is at 37 degrees Celsius, and it helps grow any bacteria that might be in the vials. That's pretty cool. It's a special incubator that keeps stuff warm, and it also rocks the tube. Like, when you first open it, you see all the tubes kind of slide down, and then you put it back in and you shut the door, and it rocks. It rocks the whole time. I love it. Back tech's pretty cool. And then next, I have a swab. Let's see, its official name is just the collection and transport system. But this is what we use when there's like a respiratory panel. If a doctor orders a respiratory panel, if they think that there's like a pneumonia involved in whatever the person has, they'll order one of these, and we put them into these little tubes, and the media inside here it helps develop like a virus or anything. It says specifically it's for the transport of viruses, chlamydia, mycoplasma, and ureaplasma. But what we do is we stick this thing up somebody's nose. I'll take it out and show you. My mom was a respiratory therapist, and so I try to make her proud every time I stick this up somebody's nose, because she used to take these too. These right here, you can just barely see it. Yeah, this wire bends, and I take that as my sign that it's supposed to bend. So it goes up one side of the nose and then the other, and I always try to get until I feel something stopping the swab, or until I feel it go into that cavity. There's like a cavity you can pop through and swab in. It's extremely uncomfortable. It's probably the most painful thing I do at work, is this right here, this. And then when all this COVID, broke out, our lab, see, we originally had some from LabCorp, but then we started using this method. The doctor would order a PCR, which is a DNA test. It tests for the DNA of viruses, if there are any. And if it comes back negative, which is really annoying to me, because you can have multiple diagnoses, but if the PCR, which is the DNA test, comes back negative, then they send it out to either LabCorp or a state lab to be tested for COVID. But we just got some new COVID tests that are specifically for COVID. So, but anyways, this is what we've been doing for like a month now. Over a month now. That. And then, let's see. But it's also good for like pneumonia. If you want to see if somebody has pneumonia. That was what we always used it before. And then we've got specific swabs for strep and flu. Those are two separate swabs, and they test specifically for flu or strep. Okay, and then next we have this, and this is a wound swab. You can swab pretty much anything, and it'll show bacteria. I love this stuff. So like, let's say you have an abscess anywhere on you. You can take this and like swab the abscess, and then, just stick it back down in here, take it downstairs, and then plate it. You want to refrigerate it before you plate it, because I guess if it's left at room temperature, the bacteria could evaporate or die or whatever. You take it downstairs and you use these plates, and I love these plates. Let's go. So the first one you would plate would be your blood agar, or BAP for short, blood agar plate. Wherever I put it. Right here. You would swab it first because it doesn't have any growth inhibiting, it's nothing but just a media to let any and all bacteria grow on it. And you just swab the side, and you do that with all of these. And here's chocolate, and it has some growth inhibiting properties to it, but it's not as bad as McConkey. McConkey, it kind of filters out some of the lesser bacteria, and it grows, I think, like strep, like the hardcore bacteria right here. And you just swab one side, and then over here, once you get your specimen spread on your plates, you go back in with a loop, with this big loop right here. It's a little bit bigger, and then the urine one, I'll tell you about that one later. And you go in, and then you just kind of get it all over the loop, and then you turn it, and that's how you plate. Not exactly how you plate. I know how to plate for real. You might not be able to see that, but you're spreading it out, and you're gonna put this into an incubator. We have 2 different incubators for the different types of media here, but having it on these different plates and putting it in at different temperatures helps the lab techs to figure out like what the specific bacteria is. That's how they pinpoint what bacteria it is when it's a wound infection or just any kind of physical non-blood. Well, actually, they do that for blood cultures too. But anyways, that's how they figure out what bacteria it is. Oh, and then another one. This one's super easy. We do, we plate urine specimens. So in the ER, almost everybody gets a UA specimen. Almost everybody gets it ordered. Whether it ever makes it to the lab or not is anybody's guess. But the doctor will order a UA. And UAs test for like all kinds of things. I don't really know it because the techs do most of it. But one of the things they test for is like a pre-urine culture. Like if it shows signs of having infection in it, the UA will reflex, and that'll flag it to have a urine culture done. So if a urine culture is required, we will take a specimen, and then much like with our other plates, we will get a biplate, and this is half blood auger and half McConkey. And you always want to do the red first because it doesn't have any inhibiting growth properties. And you just plate, and then you take another dip, do your line, and then your squiggles. And that, if you can kind of see, there you go, just to spread out all the bacteria that may or may not be there. And wherever my lid went, and for that one you use this little clear loop. It's tiny little. It's not like the blue one. Oh, and another thing I forgot to mention about these wound things. This right here is thioglycolate, and you take what you have on your specimen and you dip it in there and swirl it around, and then this will be another way to pinpoint what the infection is. This also gets incubated. It gets incubated in a 37-degree incubator. Alright, and then another thing we have, just randomly picked these up. These right here, these are finger tubes. And they can be easier, they can be hard. If somebody gets a chemistry test, we can do almost any chemistry test right here in this. If you look real close, it's got that exotropic gel in there. It gets spun down in the centrifuge just like the big tubes, and the serum will come to the top, and you can test from that. And this is CBC, and you can do almost anything with a CBC. You can't do a sed rate because that takes a lot of blood, but you just spin these down like a normal tube, and then the properties will still be in there. And the way you take it is you just take a little tiny single-use lancet, press it to the skin, and then you milk it. Which for some people is really, really hard if they're all cold and dehydrated and stuff. And some people bleed like stuck pigs, excuse my language, but that also happens. So there's a little bit about being in the lab and being a phlebotomist and doing all that hard work. Alrighty, thank you.